Welcome to Public Forum, a community outreach program produced at North Idaho College on the shores of Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guest.
I'm pleased to welcome you to a two-part series today and again next week on the North Idaho College Public Forum. One of the very important and serious issues in our country is dealing with the uninsured, and so we'll be discussing, the official title is Covering the Uninsured, Health Care for All, and there are some very bleak statistics in relation to this issue, and we have three real experts with us today in order to deal with this very important subject. I first of all would like to welcome to the program Karen Cotton, who is the program manager for North Idaho Partners in Karen. Karen, thank you so much. You have helped me put this program together, and we appreciate it very much. We're equally pleased to have our other two guests, Kelly Richards, who holds an MBA degree, and she is working with a grant called Covering Kids and Families in Idaho. And Kelly, thank you for taking the time to be with us.
Thank you.
And also so pleased to have Dr. Justin Storm Gibson, a medical doctor with the North Idaho Eye Institute, and Dr. Storm Gibson is a person that you give a lot of time and energy to this very important issue, and we appreciate that very much, and we're looking forward to this interview with all three of you. As always, I'm so pleased to have our regular panelist, Janell Burke, who is an attorney in the state of Idaho, and she will open up the discussion with her first question.
As Tony indicated, this is a very important subject, and it's one that people all over the country and locally as well are talking about. My first round of questions for each one of you will be twofold. First, what are your qualifications? And secondly, what program do you represent? So let's start with Karen, and can you tell us a little bit about yourself and then what your position is here today?
Thank you, sure. I represent a coalition of healthcare providers and organizations in North Idaho called North Idaho Partners in Care. My background, I come from working with the Department of Health and Welfare and also at Kootenai Medical Center. The partners in this organization are the 5 hospitals in each of our county. That's Kootenai Medical Center, Bonner General, Boundary Community College, Benewah Community College, and Shoshone Medical Center. Also Panhandle Health District, Health and Welfare, North Idaho Health Network, and then the volunteer clinics that we have in each of the counties.
Do you have any idea whether similar type programs are being conducted in other areas?
We're very unique in this state. We have wonderful collaboration in our community and our whole region up here. There are some other similar organizations in the state, but I think we are really unique here.
Thanks. And Kelly, what about you?
I represent a National Healthcare Foundation. The Robert Wood Johnson Foundation has created this national initiative called Covering Kids and Families. And in Idaho, we have 3 pilot sites for this initiative, and one of those pilot sites is the 5 northern counties in Idaho. And so that's what I'm working on. The main objective of the initiative is to ease enrollment processes for low-income children in order to have the access to the health care that they need.
What is your background?
My background is in marketing and business, and the reason that applies to this healthcare initiative is a lot of this grant is outreach, trying to find the children who are not covered and need to be, and also working with some of the state agencies to maybe develop some look at the efficiencies of the way the enrollment process is working, and maybe break down some of those barriers to provide better access.
Dr. Storm Gibson, can you tell us a little bit about yourself and then why you're here today?
Sure. I'm a clinical ophthalmologist in private practice here in Coeur d'Alene. I've been in practice for 11 years here in town, and prior to my specializing in ophthalmology, I was a general practice doctor for 4 years in Latin America and in the Bay Area. And I'm here because I see patients from all ages, children and elderly patients, all of which have to deal with this cost of medical care issue on a daily basis, and we see the problems of the uninsured all the time in our clinical practice.
In your private practices?
Sure.
One of the things that Karen and I talked about in preparing for this program is that even though so far on the program we've emphasized your very fine program here in North Idaho, one of the reasons for doing this program was that there's really a national thrust to this question. As we're taping it here in March, I'll let it air later. And maybe I'll start with you, Karen, and talk about let's talk about the national scope to this question. Before we get into some of the very sobering statistics, give us a little more background in what is happening. Kelly also has mentioned about a grant that's nationwide. What is this national campaign? Is part of it to raise the level of awareness?
It is to raise the level of awareness, to get people talking about the issue and recognizing that this is not an issue that is unique to lower income people. It is not unique to people who aren't working. It's a problem that's pervasive throughout our entire nation. In fact, 8 out of 10 people who don't have health insurance come from a family with at least one person working in the family. So it's an issue that everyday people, we know that people are out there who work, who don't have health insurance provided through their businesses, and it's very, very expensive to purchase health insurance.
Yes, if you're not with a company or group insurance of some type. Kelly, I'll have a follow-up on that. As you're working on this, you obviously are in touch with others in this grant across the country. What can you add concerning, do we have any surveys or how much are the American people who are covered aware of those who aren't?
I can't think of any statistics off the top of my head where awareness about the uninsured. What we are doing on a national level, I just came back from a national conference, and what was so great about that is that the Robert Wood Johnson Foundation has created these initiatives in every state, and each state is in a different place. Some of the things we're doing in Idaho or working on doing have been done already in some other states, so it gives us a chance to learn from some of the things that have been done and have worked, so we can kind of implement those. There are some states that are doing some groundbreaking work. On a national level, there's a lot of great things being done to break down some of the barriers to access to health care so that children can have health care, live healthier, and learn better.
Thank you. And Dr. Storm Gibson, you're in the medical field, and I, first of all, I want to praise you because you're a very socially conscious person. I know that, and some of the concerns that you've had in different fields, and you're really a model in that way. As you talk with your colleagues, not only here but around the country, what is happening within the medical profession to try to bring this awareness to public policy issues, or what can we do where the medical field can be so helpful?
Well, I think that it's a very complex issue, obviously, how to provide health care to all of our citizens. And there's lots of different perspectives. There's the patient's perspective, both the insured and uninsured, and then there's the physician's or provider's perspective, and the taxpayer's perspective as well. And I think what needs to happen is these groups need to come together and figure out a way that we can provide health care for everyone in this nation. We're the wealthiest country in the world, and it's really a shame that we haven't been able to come together with some consensus to cover everybody.
Because there are other countries, democracies in particular, that do cover all their citizenry. One more question before we go back to Janell, and that is, I just think that it'd be very important. I know Janell's going to be moving into the problem and identifying it, but just for a moment, let's just talk about the raw data, that is the number of people. When we talk about uninsured, we haven't shared with our viewers yet what the magnitude of this is. And so from the data you gave me, Kieran, are we still fairly correct when we say, or maybe I should ask you, how many millions of Americans at this time are without insurance for health purposes?
There are 41 million people in the United States without health insurance. 41 million.
And that includes out of a population of around 280 million, I believe. That's a very high figure.
It's very high.
Would you give us a couple more statistics? You already mentioned that 8 out of 10 of those that are uninsured are from working families. In other words, people are working, and yet wherever they're working, that they're particularly in a position where there's not any coverage. Could you add to that?
Sure.
And how many are children?
In Idaho, we know that there are about 220,000 people without health insurance.
Out of a population about 1.25 million.
Right. So it's very large. In Kootenai County and in all of our counties, all 5 of our counties in North Idaho, we have about 25% of our population that's uninsured. In the state, that level is 16%, and across the nation, it's about 15%. So we often say if Kootenai County was a state, we would have the highest uninsured rate in the nation.
Janell Burke.
Well, this series of questions is going to be different for each one of you, but we'll start with Karen again. There are some difficulties to obtaining health care or obtaining health insurance, let's put it that way. What are some of those difficulties? Let's say a person just wants to go out and obtain health insurance. What are some of the difficulties, things that they might run into? Their own health might be an impediment.
True. Probably the biggest is the cost. It's very expensive to purchase an individual policy. If a person is on a group policy, it's a little bit cheaper, but it could range anywhere between $400 and $600 a month to insure a family in health insurance. So the cost is certainly a factor. If a person has any kind of an illness, they may not be picked up and covered under health insurance. And there's just, in some communities, there are not very many companies, if any, that are even offering private health insurance coverage.
So there can be some real impediments to obtaining coverage, even if you wanted to or could afford to. In addition to those, what are the specific problems that children face in obtaining coverage?
Well, what we work on with the Children's Health Insurance Program, and when we talk about a national initiative, our state, the income levels for the family are at about 150% of poverty level, and that's where we set our levels. Now, different states may have different levels, and when the levels get a little higher, in some cases the access becomes better because people who are working, again, these are 8 out of 10 come from working families, people who are working but just can't afford health insurance, they are allowed to make a little bit more money and still be eligible for this program. So one of the problems we're having is that our state is one of the lowest in terms of access, and so we'd like to look at maybe some solutions around that.
How do children's health programs work in general? Do the children...
Our state is a Medicaid expansion state, so it is a Medicaid program. It is designed for income levels that are at 133% of poverty to 150%, and it's a program designed for working families. And these are families who are working and maybe the health insurance is offered through their employer, but they can't afford it, or it's just not offered at all. And so we're really trying to target those families.
Dr. Stonewall Gibson, there are some problems for the private practitioner too when people can't pay. Can you tell us if a person does not have insurance, what are some of the problems that the healthcare provider faces?
Well, healthcare is expensive. I mean, we have very high technology, the types of equipments we use, the types of treatments that we can apply, the diagnostic techniques we use, and so we have to somehow recoup those costs. And in the medical profession, for people who can't pay and can't afford to pay with cash, we end up having to somehow cover that cost otherwise. And for instance, in the hospital, in the emergency rooms, when people can't pay, those costs get cost shifted over either to private health insurances, and therefore people who are paying private health insurance, their premiums go up, or it goes to an indigent fund, which is usually covered locally by property taxes or on the state level through your state taxes. So for people who aren't covered, it's not that the rest of the public isn't paying, it's just that those costs are being shifted elsewhere.
And shifted in a way that we don't always see them.
Correct.
Is that correct?
That's right.
So it does work some problems for healthcare providers. Any of the three of you, do you want to speak to the bankruptcy problem that occurs with regard to people oftentimes who cannot pay?
We know that statistically medical bills is the leading cause of bankruptcy in the United States.
And in cases where there is bankruptcy, of course, then the healthcare provider may be one of those persons who does not get paid their money. Is that correct?
That's certainly possible.
When we talk about the uninsured, one of the main topics is that it is an economic issue in that you're paying for it anyway. If we can get people insured in the first place, then they're getting better. They're getting care because they can go to the doctor before they're sick. They can go see a dentist. They can get prescriptions, things that they need before the problem becomes a very serious problem.
That's a very important point, because if people have insurance, they're much more likely to go to the physician earlier. If, for instance, children who have a chronic illness or an intermittent illness like asthma can be treated on an outpatient basis. If they're reluctant to go to see their provider and get that ongoing care, then they're more likely to wait until the child is very sick and much more likely to end up in the hospital, which costs everybody more.
So you're really saying that preventive health care through insurance can be very helpful and actually cost effective.
Oh, absolutely. In my field, ophthalmology for instance, children who have eye problems often can develop a permanent eye problem if they're not treated before a certain age. Once they've reached that critical age level, that the vision in that eye can be lost permanently. And if people don't have insurance, they're less likely to come and have those examinations and those treatments that can prevent a lifelong disability.
I'm going to follow up that issue with Karen, because she and I talked about this, and others can participate, of course. But in the data that I received from you, I was just troubled with the fact that it shows that our good American citizens and residents who do not have health care, they have more illnesses. They die at a younger age. I also saw in your data that uninsured women develop breast cancers twice as likely to have it as women who are having preventive care. And in the case of men, that the late stage of colon cancer is more likely because, again, not going in those early stages to prevent it. So I've provided some of the data that you gave me, but would you react to that and say, how much are we aware of that particular problem?
Well, I think one of the issues is that that preventative care people don't know about. They don't have an option. They can't pay for it, and so they do wait. We had a particular case in the hospital not too long ago where the person had come into the emergency room because they had an abscessed tooth. They didn't have the money to go to the doctor. They tried to treat it on their own, like a lot of us do at home, and it became so severe that they had to go into the emergency room. It became much worse. The person ended up in the ICU in the hospital for 3 days with IV medications, being treated in the hospital because of an abscessed tooth. That's not right. That shouldn't be happening.
I would react to that two ways. One is that it puts the person through much more pain than they would have had, which is very unfortunate. And then the second point is that it did wind up costing, that had to be paid. Kelly, maybe you'd like to follow up on that, and from any of the studies or this foundation that's trying to address this problem, if we were to find, as the doctor had indicated earlier, bringing all these different important units together to work out some kind of solution or plan, if we did that and we intervened earlier, could we do this for the same dollars we have now? It wouldn't, many people feel that if you cover everyone somehow that it's going to cost more.
Well, for the Children's Health Insurance Program, in terms of an economic issue, and without trying to get too complicated into the numbers, we receive as a state for children who are insured under Children's Health Insurance, this Medicaid expansion program, we receive more dollars from the federal government as a state match than we do for a basic Medicaid program. So that's in essence more money coming into our state to help pay for these costs.
And earlier too, you talked about who qualifies, and you're so used to using these statistics. And you talked about 130 to 150%. Can you put some dollar figures behind that?
What does that mean? Basically, for a family of 4, and the levels change depending on how many people are in the family. For a family of 4, you can earn up to $27,600 a year to qualify for this.
What's that again?
$27,600 a year to qualify for this program, which equates to $2,300 a month. So that gives people an idea of where they may be. Those numbers change depending on how many people are in the family.
Okay, thank you. And I will ask also Dr. Stromo Gibson, we've talked about this already, but someone who's close to the whole process, obviously if someone comes in for some kind of modest preventive care, that bill is really different than someone who has a major medical problem in the hospital. Would you, I'm not trying to put words in your mouth, but is there some validity to what I'm saying is that we could use the same dollars and solve this problem if we had everyone covered and had trying to prevent certain major illnesses before they got to a certain point?
Sure, I think if you can catch illnesses in an early stage and treat them early, you're going to prevent many of the emergency room visits and hospitalizations that happen later. The asthma example is just one, but that's a very common problem. My wife is a pediatrician. She sees patients frequently frequently who don't have insurance and postpone their care. Or she was telling me the other day about a patient who didn't qualify for this CHIP program that Kelly was talking about because they earned $100 more than the cutoff point per month, and they couldn't afford the antibiotic that she had prescribed. So she had to scrounge up sample antibiotics to give to the patients. But it's a real issue that affects real people, and we really need to come to some kind of solution.
Thank you. Janell Burke.
My next question as well is going to be different for each one of the three of you. The first question that I have is for Karen again. With regard to group health insurance, how do most people that are insured find their insurance? Is it through their groups? And how many people are left out because they really don't belong to a group?
We know that about 60% of the people in our county here have their health insurance provided through their employer. That's also dropping. We do know that.
Yes, that's my next question was, is it less frequently covered now than it was in the past?
Yes. In fact, this year, the estimated percentage rate to businesses is going to be anywhere between 15 and 25% increase in their health insurance costs to provide to their employees. So what happens is businesses have to make a decision. I have a story about a lady in Wisconsin who owns a small bakery in a town of 2,000 people. She's had this business for 25 years. She has always prided herself on being able to provide health insurance for her few employees. One year this was about a year ago, the insurance provider pulled out of her community, so she had to go out and purchase new health insurance. When she began looking around, the rates were increasing by 300%. She couldn't provide it anymore, so she wasn't able to provide health insurance. And she said how horrible that was to go in every day and face these people that she has worked with for years. And there was one lady who was receiving medical treatment who couldn't pay for it anymore. And so I think many of the employees do want to provide health insurance, but it is so expensive for them.
I think that's a really important point for us to make, that there are a lot of wonderful employers like this lady who have small businesses, and they simply don't have, like in her business, she couldn't just keep raising prices, so she just simply could not provide enough funds to do what she really wanted to do. So I think we'll make that point, but maybe I'll just follow up on that and then I'll go back to Janell, and that is, as we go into solutions, maybe in the next program, if we're going to be able to solve that problem, it's going to require some kind of intervention to help those small businesses, right?
I believe it is. And there are some models being looked at, and we can talk about that.
Back to Janell.
And in fact, there are a lot of people who work part-time and also are not covered by, even with employers who do have health insurance, a part-time employee may not be covered.
That's true.
Now, Kelly, my next question for you has to do with children in single-parent homes. What is the impact there?
Well, coming from this national conference last week, I heard a great story. And some of the statistics show that between 1994 and 2000, what we're studying single mothers and as mothers come off of welfare into the workplace and what that means. And while they were seeing a large increase in single mothers coming off of welfare working, and they were seeing an even bigger increase in those not being uninsured. So they were coming off of welfare, working, but not having access to health care. So again, it comes back to the working families and part-time or lower wage jobs. They just can't afford it. Small businesses can't afford to offer it. If it is offered, often the employee can't afford to pay for it.
Dr. Sturmel Gibson, we talked earlier a little bit about the implications of not having insurance. Can you speak to the quality of care when people don't have insurance as opposed to when they do have insurance? Now, I'm not talking so much as about the fact that the patient themselves don't come, but what implications does it have for the whole healthcare system when people are not insured and they present at the doctor's office?
In my experience, I think the quality of care that's provided those patients is pretty similar to patients who don't have health insurance, except for maybe elective procedures or things that they would pay for outside of the insurance realm anyway.
Yes, a little cosmetics.
Right. I think it's more of a delay in care. Having worked in the San Francisco Bay Area, I know the county system that they have set up there is basically set up to cover people who are uninsured or have no other access to paying for health care. And I think there's a delay in the system. It takes longer for people to get in, and sometimes if it's a critical issue, delay in care can lead to major problems down the road. So I think once a patient is in treatment, is in the emergency room, in the hospital, I don't think there's really a difference in terms of how they're treated. It certainly can affect, in my practice, can affect the antibiotics that I might prescribe for a patient. If I know that they can't afford the antibiotics, I might prescribe an antibiotic that maybe doesn't have 100% coverage for the bacteria that it might cover otherwise, and so I'll give them one that's less expensive and has a 95% chance of working. So in those situations, we might make some exceptions, but in general, we wouldn't compromise what we think would be quality care because they can't pay.
And that would be the same with auxiliary health services, such as, for example, physical therapy, or perhaps the kind of eyewear that someone might be prescribed.
Well, that's a good point. I mean, I think, for instance, the quality of the frames and or glasses that someone would get under a Medicaid program would be different. The Medicaid program has its own set of its own laboratory and its own set of frames, et cetera. They contract specifically with certain providers for eye glasses, and they might not be the same quality that we would find in a private optician's practice.
That's very interesting, and one that perhaps a lot of people don't know is that there may be some preferred providers out there. I don't know if that's the correct terminology, but there might be ways that people are steered toward a particular pharmaceutical product or perhaps the treatment because of it.
On that note, we have to bring the permanent conclusion. And Janell, we can continue this next week with our very fine guest. I'm very pleased to report that you will be back again next week for our viewers, so we can cover even in more depth this very, very important question that is a really high on the list of domestic issues in our country and what we might do about it. Ladies and gentlemen, we've been covering the subject titled Covering the Uninsured Health Care for All. Please be with us again next week at the same time. We'll continue the subject. Until then, please have a good week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running in-house college production on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us at this same time next week for another edition of Public Forum on this public television station.